Welcome to the podcast. I'm really excited to chat with you because you are a seasoned founder in the tech nonprofit space and have a lot of lessons to share. Um, we first connected a few years ago because I did a web accessibility project to help you get more government contracts. And I love the chats we had. I learned a lot. Um, do you want to maybe start with an introduction about yourself, your background as a paramedic, and how you got into the tech nonprofit space?
Yeah, absolutely, Faiz. Thanks so much for the opportunity to join you, and very excited to see you get this started. I think there's a real need for a podcast like this, so glad to be a part of it and wishing you much success. So my background is I am a paramedic by training. I live here in San Diego, California, which, for those who don't know, is the southwestern corner of the United States, right along the border with Mexico, Tijuana, Mexico. And yeah, I used to work as a medic here from 2006 to about 2010. During that time, I was on a disaster response team, and we got sent to different places. I also, prior to becoming a paramedic, I lived in Central America, where I was an English teacher, and I had learned Spanish. So while I was working as a medic in San Diego, I also volunteered from time to time as a medic with the Tijuana Red Cross. And while working with them, I became very interested in the idea of how do you build an emergency medical system when you don't have all of the funds that we have here in the United States? And really focused on helping with training. Also was able to secure a bunch of EKG monitors that we were able to donate to different ambulance services in Mexico and actually in Ecuador and a couple other places. But really got interested in emergency medical services development. And it also was clear from other international development programs and projects and organizations that EMS was not something that they were focused on, which I found at the time didn't make a lot of sense because, when you think about disaster response or you think about complex emergencies, that the big thing is that people are getting sick and injured at home on the streets outside of the hospital. And yet there was no coordinated way or even a lot of development efforts to improve access to pre-hospital care so that they could get to the hospital and get the definitive treatment that they needed. So started looking for other groups that were involved in this, and other than the Red Cross, didn't really see too many that were doing it. And then I got sent to Haiti after the 2010 earthquake on a disaster response team. And when I got there, there was no 911 system, as it were, at all. There were no ambulances, there was no communication center, there was no organized pre-hospital emergency care system at all. And I thought Tijuana and other locations in Mexico had a difficult. Haiti had nothing. At the same time, if you went to the hospitals, you would see that they were completely packed with very sick and injured people. And so, how did they get here? How did all these people get here? And the answer is in the back of a pickup truck, in the back of a taxi, on the back of a motorcycle. Um, there were people who were willing to help, and they had transport, and they had phones in their pockets. And so these informal, ad hoc, on the fly emergency response systems existed, and they were completely uncoordinated, not very reliable, and not standardized in any way, but they were everywhere. They were robust because people who needed to get to the hospital often, especially in cities, could find a way to get there. And so I was only in Haiti for a week or so. But this kind of idea about, well, again, you kind of have the core components there, people who are willing to help, transport for the sick and injured, and phones for communication. And so began to really think about, well, instead of trying to transplant the US or Australian system to Haiti, which was completely unrealistic, uh, were there alternatives? And so about a year later, I went back to Haiti full time. I got a job with an international NGO called Project Hope, where I became the country director, and we were involved in different health reconstruction projects because Haiti's, it, particularly in Port-au-Prince, the capital, the health care system was literally crushed. Um, so got involved in different health reconstruction projects, but one of the things I was working on as well was pre-hospital care development and very small scale, modest stuff, training responders, working on, coordinating transport, helping them with equipment and supplies, whether that was procuring them or fashioning their own bandages and splints, stuff like that, leveraging available resources as the term goes. But in my mind, it was like, you can have trained responders, you can have transport, you can have resources and supplies, but if these responders don't know when and where they're needed, they're not going to get there quickly. So going back to the idea that everyone had phones in their pockets, it was like, well, what if we had a simple messaging system where you could send alerts to people in the community who had phones, who were trained, had supplies, transport, tell them where to go, track their progress, and from start to finish, then you could have a rudimentary but a pretty structured emergency medical system. And so it took me about 2 years to realize. I drew up the diagrams for the workflow, modeled very much after what we did on the ambulance in the United States. And it took me about 2 years to realize nobody was going to pay for this. So eventually I left Haiti, went home, got a place in New York City, paid out of pocket to build the prototype for this software system. I didn't even call it software. It was a messaging system, and got the prototype in 2013, and it worked. It did what it was supposed to. It sent out a message, SMS, to a bunch of phone numbers saying, hey, there's a car accident at this location. Can you go? And then for the people who received it, they could reply, yeah, I can be there in 5 minutes, 10 minutes, 20 minutes. And using some very basic logic, it decided who would go and who wouldn't. And then for those people that were assigned to the incident, it would just track them. Are you going? Are you on your way? Are you there? Do you need additional resources? Are you transporting? If so, where? Have you arrived at the destination? Are you finished? Etc. Again, the same workflow we were using on the ambulance in the United States, and pretty much the workflow any emergency response agency or responder will use to track their progress as they respond and transport. And I was like, wow, this works. And so that was 2013. Here we are 13 years later, and that little simple messaging system is now a very sophisticated, robust dispatch platform called Beacon. And it still uses that same workflow because it's how you respond to emergencies, right? There's no magic sauce in there. But it's all of the things that now are built around it to support it that have made it a very capable system. And so it's what we would call a CAD, computer-aided dispatch platform, cloud-based, easy to use, mobile first. We're supporting emergency response agencies in about 19 countries right now, including 13 states in the United States, and it supports a wide range of different response agencies, from your traditional ambulance service, fire departments, search and rescue teams, to what we would call alternative or crisis response agencies like mental health crisis, domestic violence, opioid overdose, homeless outreach and crisis response, pediatric health hotline. And the interesting thing is the first programs that we launched in 2014 were in the Dominican Republic and Tanzania. And those response agencies to this day are using Beacon. So it's had some real staying power, and it's been a long, oftentimes agonizing journey, but we're doing better than ever. And we've got more opportunities than ever. We're serving more people than ever. We've got more staff than we've ever had. And it's paying off, right? It's little by little, you eventually get there. I think so much of it has to do with staying power. And we keep showing up and we keep the lights on and we keep growing. So, and above all, we're providing a product that has value. So yeah, that's it. There you go. That's the nickel tour.
Amazing. Yeah, it's really inspiring journey because as a non-technical founder, you had lived experience with emergency response. You saw a gap in the market, and then you just kind of started building the solution bit by bit. In one of our earlier chats, you mentioned that naivety can actually be an asset.
Yes, this is absolutely true. If you were to have told me in 2013, when I first decided I'm doing this full time, if you were to have told me what it would take to get to where we are now, 13 years later, I wouldn't have done it. There's no doubt about it. I would not have done it. I wouldn't have done it out of both a lack of maturity, um, probably out of uh, unrealistic expectations for what I would have been able to have achieve otherwise. Probably out of greed too, that, this is not a lucrative lifestyle I'm living, and probably would have seen myself having a much higher standard of living than I do. I mean, I'm not poor. Uh, I'm not living hand to mouth, but I'm not far off. So yeah, I probably being naive, not only in terms of the rewards, so to speak, uh, the lifestyle that would have come from it, but even just the amount of work that it would have taken. I would have thought, wow, that is an extraordinary amount of responsibility to take on. That is a nonstop problem solving and nonstop education. You know, you you don't get training in and this is true for any startup, whether you're for profit, nonprofit, whatever you're doing. If you're going to start a business, there's so much you just don't know about. You can't know about. And um, even if you go to a startup accelerator, an incubator, or you take courses in entrepreneurship, if anything, they're going to be a mile wide and an inch deep. But as the founder, especially when you're the only founder or the sole founder, which another naive mistake I made, you just have to, whatever problem comes up, you have to solve it. Or at least you have to have a way to either provide a solution or a very good reason why you're going to ignore it. And so, you know, name it, you have to learn it: regulation, finance, law, contracting, technical, in just in the technology alone, it's crazy all the things that come across your desk. And I probably would have said, how about I focus on a couple things that I'm really good at, as opposed to trying to tackle all sorts of things I know nothing about. So not being aware of all of that certainly helped in keeping me involved, if that makes sense.
Yeah, yeah. It's like you jump off a cliff and learn how to build an aeroplane on the way down.
Yeah, yeah, definitely. There's a lot to that.
Great. Thanks for sharing. So yeah, we covered your background, your experience as a non-technical founder. I also wanted to talk about how tech was a core part of your project from the very early days, because for most nonprofits, that's usually not the case. But you saw technology and software as an opportunity to have massive scale and impact.
Yes and no, or I should say no and yes. When we started, my idea for this was we were going to be a consultancy, or what some people will call an administrative services organization, an ASO, or program management, right? So I listed those four things, well, three of the four core components of an emergency medical system: trained responders with supplies, who have transport and communications, and are well managed. Those are the four things you need to set up even the most basic, but an effective, reliable, consistent emergency medical system. Responders who are equipped, who have transport, who have phones, and who are managed. So our whole pitch was, we can help you with all four. We can help you with training and resource procurement. We can advise you on transportation and all that's included. We've got this idea for a software system to communicate between each other. And if you've got phones, then you'll be good to go. And then we know a thing or two about management because we've worked in a lot of different agencies and sectors and all that stuff. And then we got funding. Our first grant was from Google. So the first money we raised was through Indiegogo crowdsourcing. And basically that money was to make some improvements to the software and effectively to help me pay so I could continue to doing this. You know, I could pay rent and food. And then we got a grant from Google, and we got a grant from Cardinal Health. And those grants helped continue to fund the organization. And the Google money was also to build a beta platform, a beta version of the prototype. And it also included some money for program implementation in Dominican Republic and Tanzania, like I mentioned. And after that, because of the success we were having in the Dominican Republic, we got funding from USAID, the United States Agency for International Development, which no longer exists. And that money helped us start to scale, but through some bureaucratic twists of fate, that money wasn't continued. And we found ourselves holding the bag on this big province-wide expansion of this system and no funds to support it. So that was a real reckoning, almost bankrupted us. But what it did was it also forced us to say, let's look at this very ambitious organization and see what is actually realistic here. And so, like I said, at that time, we were, call us what you will, we were a program management organization, implementation and management. And it became clear very quickly that anybody could train themselves. People could get transportation on their own. They all had management. What they didn't have was good communications. They were still, I mean, at the time we were working, everybody still had flip phones. There were not many smartphones at all in these countries. And also the money that we were raising was largely because of the software that we were building. So it was kind of like, hey, take a step back and let's see, where should we focus our energies? We clearly need to narrow the mission here, you know, narrow the scope. What should we do? Oh, this software actually looks the most promising, both in terms of impact but also in terms of being able to raise more money to continue uh, delivering our services and growing our impact. And oh yeah, by the way, this looks like there's enormous opportunity for scale, and in such a way that no other organization had been able to do. Like the Red Cross, they do tons of training. You know, in some countries they'll procure resources and supplies and transport, and a few others they'll actually manage the ambulance services themselves. But they're not everywhere doing this. It's actually quite limited in where they manage ambulance services. So if an organization like the Red Cross can't get the scale that we see with this software, why should we be able to? And wouldn't that be a bit redundant if we tried? So it was evident the technology is our best, most promising route to both fulfill our mission, to expand our impact, and to have the biggest scale. And so basically one morning I woke up and was like, we're a technology organization. That's where all of our energy is being focused. That's where all the money is coming for. And that's where we're picking up the most traction. So instead of saying we're going to help you with training, transport, resources, management, communications, we changed and we said, if you have trained responders with transport and you're well managed, we know you have communications problems, we can help you. So that's where it kind of flipped from your standard international NGO to a technology NGO.
So yeah, you mentioned grants were really essential in getting the project started and, building the beta and all that. But there is inherently some instability that comes with grants. They could, if the economy goes bad, funding can dry up. So I know that you're on a mission to achieve financial sustainability in the organization and actually shift a lot of your revenue from the actual money you get from the services of your products. So selling the software to governments, to states, local counties. Can you talk a bit more about that journey to achieve financial sustainability and how you, for example, like you do have a lot of impactful work in the global south, but then if you also do a lot of work in the US that is able to actually fund a lot of the work that you do globally.
Yes, exactly. One of the things that also became apparent during this transformation from a programs focused organization to a technology organization was that, as you said, grant funding is not entirely stable. No business is guaranteed stability. Most businesses are not guaranteed stability, but living off of the goodwill of others is can be difficult. Any nonprofit will tell you this. And it became especially evident to us that the more sophisticated the technology got, the greater the baseline budget we would need just to maintain it. Not even to make improvements, to add features, to up, but to ensure that the servers were working, that the messaging was happening, that the maps were functioning. As a nonprofit, we've benefited from reduced pricing on a lot of this stuff, in some cases getting it for free. But the software code itself, software is never a one and done thing. And even if we built the perfect software code, it's still reliable on all these external services. And every day I open up my inbox and there are notices from Amazon, from Google, from Twilio, New Relic, PagerDuty, saying, hey, that version that you're using for an integration, it's being deprecated. We're putting it to bed. It's not going to be supported anymore. So you need to update to support the new version because we've got a better version. That stuff happens all the time. So you just need to you need software engineers there just to make sure that you can maintain what your software does right now, let alone all the other features that your users are asking for that they need, as well as what your competitors are doing. So the more sophisticated our platform got, the more expensive it is to maintain. And fundraising is difficult, especially when you're talking about software. You know, if you look at a lot of the different nonprofits out there, they are doing things that donors can, in some cases, put their names on, right? We're sponsoring this building, or we're sponsoring these students, or these clothes, you know, whatever it is. There are things that they can put their brand on and show this is who we're supporting, and look at how we're putting our money to good use. It's hard to do that with software code. So, and a lot of times people didn't, you know, it's so abstract to them what you're talking about, especially if they're not one of your users. People who use our software can tell you, oh, we know exactly what it does. But people who don't use the software, it's kind of pie in the sky stuff sometimes. And so it just became evident that the better the software got, the more expensive it was going to be to maintain, the greater risk we were of having to shut it down. So it became evident that as well, that we would need to operate more like a nonprofit university or a nonprofit hospital, where we are selling services to those who can pay, and we're using that money, that earned revenue, to cover our operating budget, to make sure that the lights stay on, that salaries are paid, that users have access and use of our software uninterrupted. And then we could rely or pursue philanthropic giving for new services, to subsidize people who couldn't pay, to add new features, you know, to do all these other things that you want to do, but are not a part of ensuring organizational and technological stability. So starting 2018, 2019, we started pursuing users who could pay. And by that time, it was also good because our software was getting to a place where we could charge for it, right? Before that, it worked. It did what it was supposed to. People enjoyed it, but they weren't going to pay for it. But by 2018, 2019, now the software was adding a lot of new features and functionality that people were saying, hey, this is worth our money. This is an investment we should make as an organization or as an agency. And it wasn't gangbusters, you know, right off the bat. All of a sudden, all this money is flooding in from people, you know, who are willing to pay us for it. But little by little, we were able to start bringing users who were paying in. And even more to the point, the more they use the software, the more it became a fundamental or a critical part of their operations that they were paying year over year. And so that was validating as well, that not only, look, people see real value. It's not just, hey, this is useful, we like it, glad to have it. But if you guys stop supporting it, it's not going to be a huge loss for us. To, oh, they see value in this, not only to pay it for a trial run or a pilot program, as it were, but they're going to pay us year after year for it. And they're going to start expanding to other places and start using it in other locations. That was very validating to us. And it was also exciting for our donors to hear, because donors always have the concern, and totally understandably, their big fear is that, okay, we give you funding to do something, a new program, a new wing to a building, a new software feature. But if we pull funding from you, does that mean the whole thing collapses? Because they don't want to be someone who starts something and then pulls the plug on it and leaves a bunch of people hanging. And so we were then able to start talking to our donors saying, look how far we've come. Our user base is growing. Our impact is growing. We are serving the people, at risk and vulnerable populations. We have not wavered from that ever. And now we've got people who are paying us, and we are starting to see a roadmap for how we can sustain ourselves financially, and therefore won't be dependent upon you eternally. So that was very reassuring to them. And, now we were getting funding from groups like Cisco Corporate Social Responsibility, Twilio, another tech company that we've been using since day one for their messaging, and now we use them for all sorts of stuff. But they're a communications platform, and we set up the pipes. They send the messages, whether they're text messages, whether they're email. We use them for call intake, so the people we work with can answer phones now. They do all sorts of stuff, and we've been using them literally since the very beginning. PagerDuty, another company that keeps an eye on, they're like kind of beacon for software engineers. So if there's a problem in the software code, PagerDuty tells the right engineer where to go at the right time and to the right place. Just like our software sends the right emergency responder to the right time at the right place. New Relic, another company that they're like a vital signs machine for our software. So, these companies started giving us support to, again, continue expanding the software, to build features that paying users were asking for. And little by little, we were starting to get both more funding through philanthropic giving, but also earned revenue from paying users, while also keeping the software available to those agencies that needed it but couldn't pay. Now, there's an asterisk there, because there are some agencies that can't pay and need it, but we couldn't support them for free or they would bankrupt us. I mean, I can name a couple countries where we know their ambulance services are operating on shoestring budgets, but they're big. And if we were to give them our software for free, just because we give it to them for free doesn't mean it's free for us, and our server costs and our message. I mean, it's just the scale is too big. And so unfortunately, there is a limit to our subsidies. But yeah, needless to say, the philanthropic giving has been going up, but also, and to a certain extent, more importantly, the earned revenue is going up. So that's really exciting. But I'd also say, take it for what it's worth. We are in a unique position to do this. There are not a lot of nonprofits out there who have the ability to both sell services and raise money through philanthropy. Some people, a lot of times nonprofits, and thankfully, are serving needs that are needs because nobody's willing to pay for them. But they're essential. So we are in a unique position where we have the fortune to be charging people who are able to pay for our services. I know it's not a a panacea for all nonprofits. Oh, just turn around and start selling your services. Just not possible for a lot of them.
Yeah, great. And the fact that you have a B2B SaaS company that is selling a service that has annual recurring revenue, and it's such a core part of their services, that they keep it forever. That's a dream for any tech company.
Yeah, it certainly is. That is the goal, is to get new users who are see value in your product and are willing to pay for it. And then your company has the wherewithal or the capacity to ensure that they keep coming back. Uh, I think that's, stickiness, as they call it,
Right.
or satisfied customers.
So, do you think the concept of product market fit applies to the work that you do? Or is it a bit different because the end users, the first responders, the paramedics, the dispatchers, are not the ones who are paying directly for the service?
I think product market fit has everything to do with what we do. Uh, Originally, this was built for ambulance services, first responders, emergency medical responders. And when we built it, if we were to have gone, it was working well in areas where they had nothing, where there was no formal communication system. Uh, Also, these same countries tended not to have radio infrastructure. So they were using phone trees, or they were using, again, a lot of them didn't even have smartphones at the time, 2013, 2014. Certainly not like they do now. There was no proliferation of smartphones back then. So they were using text messages, but kind of one-to-one text messages and phone trees and that kind of stuff. So it was very useful to them that we had a system where they could blast text messages out to people, and people could reply, and a centralized dispatcher or call center could tell who was going where. But in the United States, they looked at it and were like, no thanks. We've got pagers, we've got radios, we've got a CAD that isn't at all compatible with flip phones or even smartphones at that point, but it does exactly what it's supposed to do. And I knew that myself because I was responding to emergencies without a flip phone or a smartphone. So there was no product market fit in the United States. But then little by little, and this has just been happening over the years, it's a slow process, but you're constantly adding features and functionality. You're constantly getting feedback from your users. You also have to be able to, see ahead, and people aren't asking for it yet, but given my experience and my staff's experience, almost all of our staff, if they're not engineers, have some background in emergency management or public safety or public health or international development. We know whereof we speak, if you will. So we're able to anticipate needs or see where things are going, or look at a program and say, we see how this can be useful to you now, but if you want to scale this up, we've got a good idea, and they're certainly going to let us know. And little by little, the snowball, it gets bigger and bigger. Or the gingerbread house starts adding new floors and new wings. And over time, we began to expand to other response agency types or focus. 911 emergency medical services is basically, if you have a medical problem, we don't care what it is, we'll show up. But but we started working with more focused groups. One of the first ones was with here in San Diego County. They stood up a mental health crisis response program that was focused specifically on people having mental health crises. And they said, the company called Telecare, guy named Tim, volunteer firefighter, so he knows CADs. He was in charge of finding the technology to support this program. It hadn't launched yet, but they were laying the foundation for what it was going to do. And he called up and he said, yeah, I think Beacon could work for us. And he said something very to me that really stuck out was, we haven't launched yet, but I want to get the technology in place now so that after it launches, we're not trying to refigure how we do things or find some software that fits our needs that doesn't exist. And he said, so we want to get this thing up and running now and make sure it works, and then that it'll be able to scale. And that started 5 years ago. They were doing 2 teams doing 50 responses a month, and now they're at close to 50 teams doing 1,000 responses a month. And that company has also taken Beacon to 3 other counties in California. And you have to build the software for the users you have, not the users you want. And so we just said, what do you need? And they always came back to us with great feedback. And lo and behold, other people needed that stuff too. And so the interesting thing is now we're at a point where our software is so feature rich and robust that now the ambulance services are coming to us. And they're saying, look, the legacy stuff, it's too cumbersome. All of it was built before smartphones, and a lot of the stuff that they're trying to do is kind of retrofitting advanced technology with the older stuff. And we're in a great position because we can jump right in with them and say, get them going. There's a group in an ambulance service in Arizona here. They signed up for an account. We didn't even know that they had signed up for an account. They were playing around with it. And then the gentleman, the EMS chief came to us and said, how much? He said, this is perfect. This is exactly what we need. And we had to go in and be like, wait, who is this? What account is this? And lo and behold, it's an ambulance service in, a rural area in Arizona with a high volume, huge coverage area. And he said to us that Beacon has done more for them in the past 3 months than this legacy system had been doing for them in the past 5 years. And so, but we weren't ready for that at all. There was no chance we would have been able to support an organization like that pretty much any time before, I would say, the past 2 years. Of course, our big challenge, like most nonprofits, is like most small nonprofits, I should say, is marketing, brand awareness. So it's really hard for us to get in front of all of the people that would need Beacon. But that's always been a problem, and it hasn't been a showstopper yet. It's also, I think, in some regards, of course, we always want more users, but there's something to be said about managed growth. You read about a lot of companies, tech companies, that they just blow up, exponential growth, and they crumble underneath the weight because they haven't had that type of volume. They don't have the organizational capacity to manage it. And now they are crushed. So don't get me wrong, we would love to see growth happening at a faster pace, but there is something to be said of managed growth and not getting too far ahead of your skis, as it were. So yeah,
Right.
a product market fit is very real. It's very real. And the best way to fit your product to the market is to understand exactly what the market wants. And the
Sweet.
best way to do that is to listen to your users.
Whilst we have a few minutes left, loved your insights so far. I wanted to ask some like rapid fire questions. One thing is, yeah, just to summarize. So, given that you're a nonprofit and you have experience working in low resource environments, you're able to fill this niche. For example, yeah, the rural parts of Arizona, even in like California, some rural places that their home address isn't available on Google Maps. So Beacon is a good fit for that kind of um, service. But also, as a nonprofit, you're able to be very price competitive because there are some other players in the emergency response software space. But if they're VC backed, then the VCs will expect a 10x return on their investment. So Beacon's able to stay true to its mission and be price competitive and, actually serve those that need it most. As it's 2026 as well, I have to ask about AI. So, is your organization using AI? Do you see opportunities now or in the future?
We're absolutely using AI. We're using AI both to serve our users, like within the operations of Beacon, but we're also using it on the back end. We use it, our developers use it to test their software code. They're not using it to write the code, they're using it to test. We use it for a bunch of administrative purposes, um, research, development purposes, marketing. Uh, yeah, there are a lot of ways that we're using it. There are a lot of ways we would continue to like to use it. I think that it's not just hype. It has very real uses, but there's the risk of using it for shortcuts that maybe you shouldn't be taking. So I think there's also the hype that is dangerous is over promising and under delivering. So I would consider our use of AI to be proficient yet sober, if I can put it that way.
Great. The technology, it moves so quickly that you don't want to be wedded to any one particular uh, vendor or method. You want to like have like a light touch approach. Does that seem to be working for you?
You know, let's be realistic about AI. You hear all of this stuff, Anthropic releases Mythos, and then all of a sudden in China they come out with Moonshot, and it's like, well, Moonshot's great, but it's not as good as Mythos. And it's like, we are never going to be using AI in the top 1% of usage where that matters. It's there's nothing about our organization that is earth-shattering. We are an on-demand delivery system. So our use of AI is, in terms of scope and uh, sophistication, quite modest. And so we don't really get too worked up about who's ahead and whatever, because it's like the camera on your iPhone. Unless you're filming like films in HD, and then who cares? It's a picture's a picture. So um we're not too worried about it. I mean, our evaluation is more on the ethics of the companies, but even still, like, how much of a difference is there really between these AI companies? I think a lot of it is marketing more than it is practice. But um, yeah, I'm not. We don't really get all that worked up about its performance. We've definitely seen there was one feature we implemented where with one AI provider we were getting 95% accuracy. We switched to another and it's 100%. We need 100%, so that's the one we went with. So there's that to it. There are practical considerations, but how advanced the stuff is, I'm not too worried about a lot of that. If that answers your question.
That's a good point because in the news cycles, I think who's performing better or worse, that's more relevant to like stock pickers in Wall Street than everyday users.
Genetic analysis, cybersecurity stuff, automated, I mean, drones and robotics and all that stuff. Okay, they probably want to know about this stuff, but we're not building neural networks. And I'm sure someone out there would be like, well, you should. Okay, you're right. But once we get a national ambulance service that is going to need that level of AI, then we'll be happy to take their recommendations.
Right. Jason, thank you so much. Your insights are really, really valuable. Um, before I
Thank
let you
you.
go, yeah, yeah, great. Yeah. Before I let you go, do you have any like one last like 30 seconds advice for anyone who wants to enter the tech nonprofit space as a founder, as a or ecosystem?
I think it's all about the mission, as cliched as it sounds. If if you have a mission, if there's a reason why you're doing what you're doing, and you are committed to serving people, and that's the end goal, then I think that's a that's where you need to start, because that's what's going to get you through all of the troubles you're going to run into. And it's also going to bring you the most satisfaction. So, um, yeah, I think it's all about the mission in the end.
Amazing. And thank you.
Thank you, Faiz. Always a pleasure. We'll definitely be in touch. Best of luck with the podcast.